The White House marked the 31st anniversary of the Americans with Disabilities Act on July 26th with an announcement that the Department of Health and Human Services and Department of Justice had put out joint guidance on whether persistent or so-called long COVID is a disability protected under the ADA for those Americans who seemingly recover from COVID-19 but still face lingering challenges like breathing problems, brain fog, chronic pain, and fatigue, as President Biden described it. These conditions can sometimes rise to the level of a disability, according to the federal agencies. According to the CDC, people with long COVID have a range of new or ongoing symptoms that can last weeks or months after they are infected with the virus that causes COVID-19, and that can worsen with physical or mental activity. Some common symptoms include tiredness or fatigue, difficulty thinking or concentrating, shortness of breath or difficulty breathing, headaches, cough, joint, or muscle pain. So the question is, can long COVID be a disability under the ADA, and under what circumstances? The short answer to that question is that long COVID can be a disability under the ADA if it substantially limits one or more major life activity. A physical impairment includes any physiological disorder or condition affecting one or more body systems, including, among others, neurological, respiratory, cardiovascular, and circulatory systems. For example, some people with long COVID experience lung damage, heart damage, including inflammation of the heart muscle, kidney damage, neurological damage, damage to the circulatory system, resulting in poor blood flow. Long COVID can also be a mental impairment when it causes lingering emotional illness or other mental health conditions. So let's talk about what a major life activity is under the ADA. It includes a wide range of activities such as caring for oneself, performing manual tasks, seeing, hearing, eating, sleeping, walking, standing, and so on. So here's an example. A person with long COVID who has lung damage that causes shortness of breath, fatigue, and related effects is substantially limited in their respiratory function. So is long COVID always a disability under the ADA? No. An individualized assessment is necessary to determine when a person's long COVID condition or any of its symptoms substantially limits a major life activity. So what rights do people whose long COVID qualifies as a disability have under the ADA? As many of you know, the ADA requires employers to engage in the interactive process to determine whether there are one or more reasonable accommodations that will enable the individual to perform the essential functions of their job. Some reasonable accommodations of long-haul COVID can include paid or unpaid leave, part-time work schedule, offering remote work, or restructuring the employee's position to eliminate one or more non-essential job functions. An employer does not have to remove essential job functions or lower production standards. The ADA does not require an employer to provide any accommodation that creates an undue hardship on the business. An employer also does not have to provide the employee's preferred accommodation so long as the employer grants an effective accommodation.